Okay, today the topic is the course is on Trauma 101. And I'm going to give you an overview of the course. This course provides an understanding of trauma, its effects on individuals, and approach to healing. Designed for as students, mental health professionals, and anyone interested in the topic. This course will cover the definitions, types of effects, and also the treatment of trauma. By the end of this course, you will be able to define trauma and distinguish between the different types of trauma. So today, module one is on the introduction to trauma. What is trauma? First of all, we are going to define the definition of trauma. Trauma is a pervasive problem. It results from exposure to an incident or series of events that are emotionally disturbing or life-threatening with lasting adverse effects on the individual functioning and mental, physical, social, emotional, and or spiritual well-being. The history of trauma. The historical trauma is a collective trauma that affects a specific cultural, racial, or ethnic group over multiple generations. It can stem from major events like slavery, the Holocaust, or the violence or colonization of Native American. Historical trauma can have many effects on individuals and communities, including your health, higher risk of mental and physical illness, substance abuse, incarceration, poverty, homelessness, and contact with child welfare. The behavior of trauma. Low self-esteem, depression, self-destructive behavior, and violence or aggressive behavior. Family and community. Weakening family and community structures. Cultural identity. Damaged cultural identity. Some ways to address historical trauma includes establishing trauma-informed, equitable, and culturally responsive policies and practice. Types of trauma. One type of trauma is acute trauma. It refers to trauma related to acute trauma or acute trauma experiences, typically in a clinical or psychological content. However, it's possible you're asking about a specific framework, organization, or concept that uses the acronym acute. If you were thinking of a particular model or system under the term acute, I'll need more contact text to assist accurately. I'll give you an overview of acute trauma and the general effects and a treatment, which could be helpful if you referring to trauma in a psychological or medical content. Acute trauma refers to a response to an event or a series of events that cause significant stress, injuries, or psychological disturbance. The trauma can result from various causes, including natural disaster, violence, and self-threatening events. Physical trauma, serious injuries to the body that may require medical treatment, and as a such as fracture, burns, or internal injuries. Psychological trauma, psychological response to events such as accidents, assaults, or exposure to violence. This can result in post-traumatic stress disorder, anxiety, depression, or acute stress disorder. Emotional shock, symptoms of acute stress, which are psychological. One of them is emotional shock, fear, helplessness, confusion, and numbness. Cognitive, difficulty concentrating, intrusive thoughts, flashbacks, and nightmares. Physical, increased heart rate, muscle tension, sleep disturbance, headaches, and dizziness. Behavioral, withdrawal, irritability, and avoidance of a reminder of the trauma. Acute stress disorder. When a person experiences trauma and displays symptoms such as flashbacks, emotional numbness, or vigilance within 3 days to 4 days of the event, they may be with acute stress disorder. If symptoms go beyond that, for a month, they may develop into post-traumatic stress disorder. Treatment of acute trauma. Psychological first aid. Early intervention aims at reducing stress and providing basic psychological support. This includes providing reassurance, helping the individual feel safe, and connecting them with mental health resources. Another treatment of acute trauma, cognitive behavior therapy, is a widely used therapeutic approach for trauma that focuses on identifying and changing negative thought patterns and behavior that stems from traumatic experiences. Eye movement, desensitization, and reprocessing, EMDR. That's a form of psychotherapy that helps individuals process and make sense of trauma memories. It involves guided eye movements to reduce the emotional impact of the memory. Medication, there is medication that is used to treat acute trauma. In some cases, medications such as antidepressants, anti-anxiety medication may be prescribed to manage the symptoms of anxiety or depression or sleep disturbances following acute stress, acute trauma. How trauma affects the brain. Acute trauma impacts brain areas involving in memory, emotional regulation, and stress response. So the amygdala, responsible for processing emotional like fear, and hippocampus, involved the memory formation, are often affected, which can contribute to symptoms like hypovigilance, intrusive memory, and difficulty of distinguishing past from present danger. Long-term impact. So if untreated or inadequately addressed, acute trauma can evolve into chronic or psychological conditions, such as post-traumatic stress disorder, or it may lead to physical health problems like chronic pain, cardiovascular issues, or gastrointestinal disorders. Chronic, we just finished with acute trauma. Now another trauma is chronic trauma. Chronic trauma refers to prolonged repeated or ongoing exposure to traumatic events or experiences. Unlike acute trauma, which occurs after a single traumatic event, chronic trauma stems from sustained, distressing circumstances, often lasting months, years, or even a lifetime. It has deep psychological, emotional, and physical effects on individuals. Types of chronic trauma. Childhood trauma, abuse, or neglect. So childhood experience of physical, emotional, or sexual abuse, as well as negative, can have long-term impacts. These types of trauma can shape an individual development, attachment style, and emotional health well into adulthood. Ongoing abuse or domestic violence. People in abusive relationship, whether domestic, sexual, or emotional, often endure chronic trauma. The repeated cycle of abuse leads to significant emotional, psychological, and sometimes physical damage. Living in a war zone or conflict area. Prolonged exposure to war, displacement, violence, or terrorism, including being a refuge, is a source of chronic trauma. This type of trauma involves constant fear, loss, irritability, which can affect an individual's mental health over time. Then there's chronic illness or medical trauma. Living with long-term illness, especially when it involves pain, frequent hospitalization, or the threat of death, can be a source of chronic trauma. It can lead to feeling of hopelessness and lost control over one's life. Chronic neglect in childhood or adulthood. Prolonged emotional neglect, including lack of affection, emotional support, or failure to meet basic needs, can lead to chronic trauma. Chronic poverty or systematic oppression. Living in poverty, dealing with chronic financial insecurity, or being marginalized due to race, gender, or other factors can contribute to ongoing trauma. Experience of racism, discrimination, and social inequality are also forms of chronic trauma. Symptoms of chronic trauma. Chronic trauma often manifests in various emotional, psychological, and physical ways. These symptoms can affect different aspects of an individual's life, including their relationship, work, and daily functioning. Emotional and psychological symptoms. Hypervigilance and anxiety, a constant state of alertness, expecting danger even in the safe situation. Depression, persistent feeling of sadness, hopelessness, and a loss of interest in life. Dissociation, feeling discomfort from oneself or the world around you. This can include memory gaps or feeling detached from reality. Intrusive memory or flashbacks. Reoccurring involuntary memories of a trauma, events often accompanied by emotional distress or physical reaction. Low self-esteem. Chronic trauma can lead to feelings of worthlessness, self-blame, and guilt, and also emotional numbness, difficulty experiencing or expressing emotions, leading to withdrawal or isolation. Emotional and physical and psychological symptoms. Trust issues. That means you have difficult to form or maintain relationships due to fear of betrayal or harm. Irritability and anger. Frustration and outbursts of anger, often without clear cause. There are also physical symptoms, sleep problems, insomnia, nightmare, disturbance, sleep due to trauma, related memories or anxiety, chronic pain, headaches, back pain, gastrointestinal issues, or other unexplained bodily symptoms. Fatigue, persistent tiredness and lack of energy, often due to the physical toll of constant stress. Weakened immune system. Chronic trauma can lead to a compromised immune system, making one more susceptible to illness. Somatic symptoms, physical pain or discomfort without a medical cause, which is common in trauma. Survival, common in trauma survivals, muscle tension and digestion problems. Behavioral symptoms. Avoidance, avoid people, places, or situations that remind the individual of their trauma, which can limit daily activities and social engagements. Substance abuse, using drugs, alcohol, or other substance to cope with emotional pain or numbness. Self-harm, engaging in self-destructive behavior as a way to manage overwhelming emotions or to feel some sense of control. How chronic trauma affects the brain. Chronic trauma has a lasting impact on the brain, particular areas that deals with memory, emotions, and stress regulation. Amygdala. The amygdala is responsible for processing emotions, especially fear. Chronic trauma can lead to an overactive amygdala, making an individual more prone to anxiety, hypervigilant, and emotional reactivity. Hippocampus. The hippocampus plays a key role in memory and learning. Chronic trauma can shrink the hippocampus, impairing memory and making it more difficult for individuals to distinguish between past and present threats. Prefrontal cortex. The prefrontal cortex helps regulate emotions and make decisions. Chronic trauma may reduce the functionality of this area, leading to difficulty in controlling impulses and managing stress. Neurotransmitter imbalance. Prolonged stress trauma can alter the balance of neurotransmitters in the brain, and dopamine, which can contribute to depression and other mental illness. Long-term effects of chronic trauma. If left untreated, chronic trauma can have significant long-term consequences on both mental and physical. Mental health disorders. Post-traumatic stress disorder can develop from chronic trauma with symptoms like flashbacks, intrusive memories, and severe anxiety. Depression and anxiety. Chronic trauma can lead to persistent depression and generalized anxiety. Complex post-traumatic stress disorder is a more severe form of PTSD caused by prolonged exposure to trauma, such as ongoing abuse or violence. It includes symptoms of post-traumatic stress disorder, along with issues like emotional dysregulation, self-destructive behavior, and difficulty with relationships. Personality disorder. Chronic trauma, especially in childhood, can contribute to the development of personality disorders, such as borderline personality disorder. Physical health problems. Chronic pain syndrome, that's conditions like fibromyalgia or chronic back pain are common in those who have experienced long-term trauma. Cardiovascular issues. Chronic stress can contribute to high blood pressure, heart disease, and strokes. Gastrointestinal problems. Stress related to disorders like irritable bowel syndrome and chronic digestive issues are linked to trauma. Autoimmune disorder. Long-term stress can weaken the immune system and potentially contribute to autoimmune disease. Impaired functioning. Difficulty in forming healthy relationships, maintaining a job, or engaging in social activities. Chronic feelings of isolation, disconnection, and inability to trust others. Treatment for chronic trauma. Healing from chronic trauma is a long-term process that often involves a combination of therapeutic approaches. Some of the most common treatment include psychotherapy, cognitive behavior therapy, focus on identifying and changing unhealthy thought patterns related to trauma. Dialectical behavior therapy helps individuals with chronic trauma regulate emotions and develop better interpersonal skills. Trauma-focused cognitive behavior therapy, designed specifically for trauma or survivors, especially in children and adolescents. Eye movement desensitization and reprocessing, which is EMDR. It helps individuals process trauma memories and reduce their emotional impacts. Somatic experiences focuses on the body awareness to trauma and that's stored in the body. Medications, antidepressants or anti-anxiety medication to help regulate mood and anxiety. Medication for sleep disorder. Sleep aid may be prescribed to address insomnia or nightmare. Support groups and peer support. Group therapy or peer support can provide validation and emotional connections with others to understand the experience of chronic trauma. Mindfulness and stress Stress management for trauma. Practice such as medication, yoga, or deep breathing exercise can reduce the psychological symptoms of stress and promote relaxation. Self-care and lifestyle changes. Building a healthy routine, regular exercise, balanced nutrition, and good sleep hygiene can support overall healing. Chronic trauma is deeply challenging and can impact many areas of life, but healing is possible through a combination of therapeutic methods, self-care practices, and support systems. Early intervention and ongoing support are key to managing symptoms and improving quality of life for those affected. Complex trauma. Sometimes called complex post-traumatic stress disorder, refers to the psychological impact of experiencing prolonged, repeated exposure to trauma events, often over a period of months or years. These trauma are typically interpersonal in the nature, such as abuse, neglect, or living in a toxic or unstable environment. Complex trauma is distinct from single incident trauma, such as a car accident or natural disaster, because of its chronic and pervasive nature. Nature of complex trauma. Chronic and prolonged. Unlike a one-time traumatic event, complex trauma involves repeated exposure to harm over time. It may include ongoing physical, emotional, or sexual abuse, neglect, domestic violence, or living in an environment with persistent stressors such as war zones or highly dysfunctional family system. Interpersonal and relational. Complex trauma also stems from relational dynamics such as attachment injuries, abuse from caregivers, manipulation and exploitation in intimate relationships. Early developmental periods. When complex trauma occurs during childhood, it can significantly affect emotional and cognitive development, impacting one's ability to form healthy relationships and manage emotions. The symptoms of complex trauma can be wide-ranging and may include emotional dysregulation, difficulty managing intense emotion, such as anger, sadness, anxiety, that can result in mood swings, feeling of emptiness, or chronic distress. Negative self-concept. Individuals with complex trauma may struggle with a poor sense of self-worth, guilt, shame, or feel fundamentally flawed or unlovable. Hypervigilant. Increased anxiety, constant sense of danger, always being on edge, often manifesting in difficulty trusting others or a fear of being hurt again. Dissociation, feeling of detached from reality, the self, or emotions. This can manifest as spacing out, or feeling as if one is observing their life from outside their body. Intrusive memory. Flashback, nightmares, or intrusive thoughts about past traumatic experiences. Difficulty relationship, trust issues, difficulty forming or maintain close relationships, and tendency to either avoid intimacy or to become overly dependent on others for validation and safety. The cause and risk factors of trauma. Just a second. Chronic abuse or neglect. Long-term exposure to physical, emotional, or sexual abuse, especially during childhood, is one of the leading causes of complex trauma. Domestic violence. Living in an environment where domestic violence is present, either as a direct victim, or as a witness, can create a traumatic experience that is deeply internalized. War conflict or political violence. Exposure to war zones, political violence, or refugees situations can also lead to complex or trauma, especially when people feel trapped in these circumstances for extended period. Bullying or harassment. Persistent bullying, discrimination, or chronic social or exclusive or circle, particularly in childhood or adolescent, or can also result in complex trauma. Diagnosis and assessment of complex trauma. Complex trauma is often misdiagnosed or not recognized because many of the symptoms overlap with mental health conditions like depression, anxiety, borderline personality disorder, or post-traumatic stress disorder. However, complex post-traumatic stress disorder is distinct in that it involves relational trauma, trauma that stems from prolonged interpersonal relationships or environments that undermine the victim's sense of safety. Symptom of emotional stress, dysfunction, dysregulation, difficulty managing emotions and mood swings, which are common in complex post-traumatic stress disorder. Problems with self-identity and dissociation. Many individuals with complex stress struggles with their self-concept, feeling of worthlessness, and many experience disassociation or personalization. The diagnosis statistical models of statistical manual of mental health disorder does not have, that's the DSM-5, does not have a separate diagnosis for complex post-traumatic stress disorder. Though it is acknowledged in research and clinical practice, however, it has been proposed as a distinct condition and is recognized by organizations like the World Health Organization, particularly in the ICD-2, International Classification of Disease. Impact on the brain and the post-traumatic stress disorder has chronic trauma has impact on the brain, is on the neurobiology. Complex trauma can alter brain structure, particular areas involving emotional regulations, like the amygdala, and memory, like the hippocampus. It creates hyperactivity in the brain, trace detection system, leading to an exaggerated response to stress or danger. Chronic health issues. Long-term trauma can also have physical health consequences, including chronic pain, gastrointestinal issues, autoimmune disorder, and sleep disturbance. Attachment issues. Individuals who experience complex trauma, especially in childhood, struggle with attachment issues, making it difficult to form healthy, secure relationships in adulthood. Treatment of complex trauma. Effective treatment often require a multi-faceted long-term approach. As the impact of complex trauma, a deep and pervasive treatment may involve trauma-focused therapy. Specific types of therapy are designed to address trauma, such as cognitive behavior therapy that can help individuals reframe negative thought patterns, understand their emotional response, and develop coping strategies. Dialectic behavior therapy, especially effective for individuals with complex trauma who have difficulty with emotional regulation and self-destructive behavior. Eye movement desensitization and reprocessing. It focuses on processing trauma memory by using bilateral stimulation, usually in the form of eye movement, to help process and integrate the traumatic memories and in distressing ways. Somatic therapy is an approach that somatic experience or sensation for a psychotherapy focus on addressing the bone's physical response to trauma and helping the body physical respond to trauma and helping individuals reconnect with their bodies. Attachment-based therapy. Healing can involve working on attachment issues, especially for those whose trauma occur in childhood and disrupts their ability to form secure relationships. Medication. In some cases, medication may be prescribed to manage the symptoms like depression, anxiety, or sleep disturbance. However, medications are often used as a part of a broader treatment plan rather than a standalone solution. Recovery and healing. Healing from complex trauma is often a slow and gradual process that involves safety and stabilization. The first step is to create a sense of safety and stabilization. This may include learning coping skills to manage overwhelming emotions and triggers. Processing trauma. Once an individual is stabilized, trauma memories can be processed through various therapeutic modalities. This might include working through painful memories, feeling of shame or grief, building resilience. Over time, healing involves reclaiming a sense of personality agency, self-worth, and finding ways to move forward in life. Many people with complex trauma find strength in developing healthy relationship, practicing self-care, and reconnecting with parts of themselves that were suppressed due to trauma. Conclusion. Complex trauma is a deeply disruptive experience that can affect all areas of life, from emotional regulation to relationship to physical health. It requires specialized long-term therapeutic approach to heal. But with the right support, individuals can learn to manage the symptoms and ultimately rebuild a healthy, more fulfilling life. Difference between trauma and stress. Okay, the aspects of stress. It responds to internal pressure or demands. That's stress. Trauma, overwhelming distress, often life-threatening events. Intensity varies for stress, varies in intensity, usually less extreme. Trauma, intensity of trauma, high intensity, overwhelming, often life-changing. Duration of stress, short-term can be chronic if unresolved. Duration of trauma, long-term, often persistent if untreated. Emotional stress, anxiety, tension, irritability, frustration. Emotional due to trauma is fear, helplessness, numbness, emotionally, and dysregulations. Okay, I'm gonna give you a case study. Sarah, a 29-year-old female, was involved in a high-speed car crash when her vehicle collided with a tree after swerving to avoid another car. She was the sole occupant of the car and was wearing a seatbelt. Emergency service arrived within 10 minutes and transported Sarah to the hospital. Upon arrival at the hospital, Sarah is conscious, but exhibiting signs of distress, significant pain. She has multiple visible injuries, including facial laceration and bruises. She also reported a sharp pain in her left leg, along with difficulty breathing. Her vital signs show elevated heart rate, low blood pressure, and mild, mild tachycardia. So the internal priority in trauma can follow the ABCDE: airway, breathing, disabilities, that's the neurological status, exposure of the environment. That's the end of my course for / presentation for Trauma 101. In the future, I'm going to come out with Trauma 102. Thank you for being attentive to my course of Trauma 101, and I'll be out soon with Trauma 102.